Good morning, viewers. Greetings on the occasion of World Hypertension Day. Every year, 17th May is celebrated as World Hypertension Day. And this year's theme is Measure your blood pressure accurately, control it, and live longer. So what is the normal blood pressure? Normal blood pressure is less than 120 and less than 70. Blood pressure between 120 to 139 and lower blood pressure between 70 to 89 is termed as elevated blood pressure, and blood pressure of 140 by 90 and above is termed as hypertension or high blood pressure. And these can be controlled, and once you control the blood pressure accurately and in a target range, you can prevent the development of stroke, heart diseases, kidney diseases, peripheral arterial diseases, and heart failure. What is the problem in our country? Let's look into the recent data. There was a study by Indian Council of Medical Research where more than 111,000 individuals were examined who were above 20 years. And as per that study, 81.2% of the individuals had some kind of cholesterol abnormality or lipid disorder. The second was overweight or obesity, which was 39%. Third was high blood pressure, which was present in 35.5% of those individuals, followed by pre-diabetes 15%, followed by diabetes, which was 10%. So the recent trend is that one third of the population, more than one third, 35.5% of the individuals have, you know, high blood pressure. Now, how can you prevent the development of high blood pressure? You can prevent the development of high blood pressure if you identify an individual who is likely to have high blood pressure. If you have family history of high blood pressure, that means if your parents have history of hypertension, then you are likely to have high blood pressure. If you are obese or overweight, if you are having sedentary habit, if you are consuming tobacco in any form, and if you don't take green leafy vegetables, fruits and vegetables, then you're likely, and also if you have you're consuming very high salt diet, these are the factors which may lead to hypertension. So how to prevent hypertension? Stick to a good dietary regimen. Don't take extra salt. Take a lot of green leafy vegetables. Then exercise regularly 40 to 45 minutes daily. Then eat food which prevents hypertension like DASH diet. That means dietary approaches to stop hypertension where a lot of green leafy vegetables are there. There is no extra salt. And then sleep 7 hours a day. Control the stress factors. So if you are having stress, that also adds to your hypertension and that may lead to development of hypertension. Once you have developed high blood pressure, then one should be able to control it. How can you control? Control is by lifestyle changes plus medications, which will be decided by your doctor. If you are having uncomplicated hypertension detected for the first time, then approach is first 3 months you try to modify your lifestyle, and if you after controlling lifestyle also if the blood pressure is not under control, then one should add all the medications that will be decided by the physician who is treating you. Now if you control the blood pressure, the benefits are enormous, and uh, which can be controlled with medication, also by lifestyle changes. The problem is many patients, they start the therapy and then stop in between, and the percentage is 50%. That means defaulters are 15%, in whom the treatment is started. 50% of them, they don't reach target. And what is the target? Mostly, in uncomplicated hypertension without any confounding disease, 120 to 129 is the target which have been set by European Society of Cardiology, and we follow that guideline. And once those individuals are taking the drugs, only 21% they reach the target. So the control of blood pressure is very tricky, and it's a joint venture between the patient and the physician, and a long-term control of blood pressure will lead to reduction in the vascular events and which will give you a good quality of life, and you will have a better tomorrow. Thank you very much.